Good morning.
Good morning, everybody.
Good morning, everybody. Want to give it 1 minute and then we'll get going?
Yes, that sounds good.
Good.
Eric, I do have a PowerPoint if you would like to use that.
I think we'll be okay. I hope. We'll try to get right to the point and move on with everybody's day.
Recording in progress.
Hey, Shannon, let's do this. Let's go ahead and pull that up, your slides.
Okay.
And we'll go off of that and then see what kind of questions there are.
Sure thing.
Okay.
Yeah, we got a few more folks that are coming in.
No, that's okay. It's okay. Sorry, everybody's time. I apologize. We'll get everybody in and get it going.
All right. We got one more person that's joining us and then
Right.
we can get going. Okay. All right. I am going to go on Facebook Live in just one moment, and then Eric, I will let you know, and you can get the show on the road, and then we can refer to the slides and go from there.
All right, good.
All right. All right, Commissioner, you're on.
All right. Okay, you ready? Let's go. Good morning, everybody. Again, happy Thanksgiving. Hopefully you're going to be getting together your family and friends and enjoying the holiday and trying to relax a little bit. But we do have some news that we want to make sure that the community had before they went away for Thanksgiving. Just a couple things with the numbers on COVID. Unfortunately, our numbers are going up here in Lucas County, but I think, again, I wasn't able to spend the entire time with the press conference from the Ohio Department of Health, but we know that Northwest Ohio is seeing substantial cases with COVID. So we are in that same boat. The cases that we had for November 16th, you can see here, I'll show that real quick, 186. Now, again, that it's not too bad when it's compared to our 250 we had, about a month and a half ago or so, but you definitely can see where, we were trailing off here in October. We started seeing a little bit of rise, and now we're definitely back into this area where we're seeing substantial transmission inside the community, which again is going to really bounce our per 100,000 numbers up. Don't know what they are. They don't come out until 2 o'clock. So if you want to go ahead and go back to the website for ODH, you can get those per 100 counts there at that point in time. Again, we have been in that substantial high category for a couple of months now, and again, just want to make sure that the community understands we're still seeing transmission. So what does that mean? Well, let's take a look at the hospital admits. It's actually higher than it ever has been. At this point in time, we have about 239 admits into Lucas County hospitals. That is the highest that we've been since the system was online. And also then too, we're seeing 84 ICU beds being used for COVID patients. Again, highest numbers we've seen. And then 50 vents, not so much the highest. I think we were higher a month and a half ago or so, but you definitely see that our hospital systems are increasing with COVID concerns, COVID admits, and COVID work. And again, just want to make sure the community understands that, you know, we still have COVID in our community. We're still dealing with. So what do we need to do? A couple things. One, we need to make sure that we understand that it is everywhere in the community. You can kind of see 613 is still high. You know, we are tracking this on a daily basis. So again, we want to make sure that community understands that we need to take some things into account when we're dealing with the disease, and with the understanding that everybody can be vaccinated, 5 and above, and booster vaccinations for those 18 and above. Just some numbers that we're looking at. Again, we are seeing that those 0 to 19s are a goodly amount of our cases in November, and then in October, and especially in September. And then we're also looking at the pediatric cases that you see that, beginning of October, middle of October, we were high, we came down, we're going back up. Again, just the idea here that this is what's happening in the community with our pediatric cases as well as our adult cases. Shannon, next slide. So what are we going to try to do here? What are we suggesting? Again, we're going to want to see our families. Please do take precautions. Here is one of the things that we're offering this week. We did yesterday at the rec center. We're doing it again today at the rec center and at the UAW hall here downtown. And then at the UAW hall tomorrow is rapid testing. You can come out, get a rapid test. Actually, you can get 6 per car, and then take those home and use them. And why is that important? Well, again, you heard early on, almost 2 years ago, about testing and about how important it is. And we at one point in time during the pandemic, we didn't have the capability of testing, but we do now. And so we can go ahead and get these rapid test kits out to the public, and they can make sure that before they go over, grandma, grandpa's, or before, they get together for the holidays, they can go ahead and test themselves and find out if at that point in time they could be infectious, and they can make a decision then to stay at home. And that's what they should be doing. They should stay at home and then not take the chance of spreading the disease and to other family members or into the community. So this is one tool, but please remember that also then too, the vaccination programs as well is still out there. We've been doing pretty good with our pediatric cases, 5 to 11. Our numbers as of yesterday morning, we did about 2,600 in about 2 weeks, and we continue to do those peds programs, those booster shots. Or excuse me, I'm sorry, the first vaccinations. But we also then have the booster shots for those adults. And again, if you didn't hear, really everybody 18 and above is eligible for that booster as long as they've had 6 months since their second dose. And again, just another tool to use. And please don't forget about the ability to mask as well too. Masking is extremely important in crowded settings. So I'm sure we're going to be going shopping. Think about wearing that mask. Wear that mask. It's going to help you out. We're in other venues where it's crowded, whether that is going to be in school after Thanksgiving or in other areas. Please remember to wear that mask. But again, wash your hands. Again, we can always talk about this. The first thing is that step one, get vaccinated. It is out there. Wear that mask. Wash your hands. Kind of what we did last year. Again, outdoors is always safer than indoors relative to the spread. And make sure that, again, you're probably going to get on a plane and travel, other means of getting to grandma and grandpa's house. So again, make sure that you're following good rules for COVID, as well as just safe travels in general. Excuse me. The other thing that I think is important, and the question that I keep on getting asked is, when do you think this will end? Again, there's pundits out there that will tell you that they know. I don't think at any point in time anybody really knows when COVID is going to end, but there are things to help with that endpoint, making sure that, again, that virus doesn't have the ability to replicate into a different variant. And the way you do that is by stopping people from getting infected. So again, vaccination, wearing the face covering, making sure you have good hand hygiene, do those things that we've talked about. If you're sick, stay at home. And again, that is really important to help the community, again, lower its COVID numbers, but again, making sure that we're doing everything we possibly can so we don't have that next variant or add to the possibility of that next variant being in one of our communities. I want to switch gears just a little bit. In general, we do this every year. And it's nice to get back to regular public health and not talk so much about COVID, even though it is so important in our community, is this idea of Thanksgiving and making sure that we're staying safe. Thanksgiving, as we've talked about in years past, is always a hectic time. You're trying to cook meals, you're trying to bring people together, and food safety is so important this time of year. We always hear about foodborne outbreaks after a Thanksgiving get together, and there's some ways that you can go ahead and make sure that you're keeping your family safe and making sure that ability for a foodborne disease is limited in any household or in any setting. And again, please visit our website. There are more than enough websites out there to get really detailed information about how to maybe do a couple of these things we're going to talk about. But again, follow them. Let's talk about a turkey, making sure that we're cooking that up properly. 165, 170 degrees. I cook my turkey to 170. That's going to kill any of the salmonella that's in there. Again, proper handling before you cook that turkey. Do not wash it off in the sink. You don't need to do that. All that does is just splatter any salmonella into surfaces you probably already cleaned. Handle it appropriately too. Keep it cold until you're ready to cook it. Keep it hot if it's sitting out. So what do we mean by hot? Again, use a thermometer. 135, 140 degrees. 140 degrees is always good if you can do that. Remember that, again, if you're going to take some time between maybe a lunch turkey dinner and a turkey lunch, and then going maybe using that for a turkey dinner, put it away, keep it cold, bring it back out, heat it up. So keep hot foods hot and cold food cold. I mean, that is just one thing. Again, too, the idea here is just be safe. Learn, educate yourself about food safety. Again, get onto one of the websites and make sure that you're following that. The best thing you can do is use the 4-hour rule. If something is sitting out of temperature for 4 hours, it needs to be pitched. And you shouldn't be consuming that. But again, just kind of rules of thumb, the best thing to do is make sure that you're keeping your hot foods hot and cold food cold. So Shannon, I think that was kind of what we wanted to cover today.
Sure thing. If any members of the media have a question, if you could kindly raise your hand virtually and I will call on you and we'll go from there. Brian Duggar, go ahead with your question.
Hi, Eric. You mentioned hospitalizations, and it looks like there's 526 in Region 1 at this point. And I'm curious, when you talk to your colleagues at nearby health boards, are there any particular areas that are really being swamped right now and maybe asking Toledo for help? Are Toledo hospitals taking transfers from other COVID patients?
Brian, I don't have any good information that. I know we just had a call yesterday with health departments and didn't really hear any of that. And I have not heard of any issues right now with bypass in the hospitals. So I got a feeling we're able to handle this right now, but that doesn't mean that that's not going to be the case in the near future. Brian, if you want me to, I can kind of reach out if you want me to, if you give me some time after this call and see what's happening.
Yeah, that'd be great. Thank you.
Sure, Brian. Get back to you.
Tricia with WTPG, go ahead and ask your question.
Hi, I sort of have a twofold question. The first is, in terms of indicators, should we be more focusing on number of cases or the number of hospitalizations? And second, do you expect those numbers to go up in the coming months or go down, stay the same?
Good questions. We've talked about this for almost 2 years now, in the sense of we need to protect the hospitals. And we saw with our last spike, 2 months ago or so, there were some real concerns at our local hospitals about bypass and those issues. So, when I'm looking at admits, I'm thinking about that to make sure that, again, that heart attack patient can be taken care of, that stroke patient, that broken leg that needs to be set, whatever it is, those things we go to the hospital for, we can be seen, and we can be seen with the same level of care and ability as we would non-COVID times. Again, hospitals here are, and I've said this and I'll continue to say this, they're amazing. They're great systems. They know the limits, they know what they need to do, they have backup plans. So again, we're very fortunate in Lucas County to have all the systems that we do and how they operate. So again, when I'm looking at a couple things. I'm looking at those admits, I'm looking at the ICU use, but then I'm also coupling that back with the increase in cases in general. And so all those things kind of throw up a red flag for myself in the sense of what's going on, where are we going to go with this? Because please remember, this disease is easily spread, this Delta variant, and that when it gets a foothold, it really has the ability to run very quickly through a community and start having these spikes again. I will say this. I was doing research again last night, trying to read up as much as I possibly can. And yes, we are having some breakthrough cases with those individuals who, the vaccine probably looks like it's waning, 6 months or so. But those individuals that are, again, having significant issues and or death are those ones that aren't vaccinated. So again, there's a couple things there when we start looking at numbers and what we need to really focus in on. And again, it's about getting vaccinated. So even if you do get sick, you're probably not going to end up in the hospital. And then that I wish I had that crystal ball that I could tell you, where do I think it's going to go? I do believe we're probably going to either stay like this after the holidays, maybe have a little bit of an increase, just because of we're going to be getting together for Thanksgiving, and then next thing we know, it's going to be the Christmas holiday. We're going to be getting together, the New Year's holiday. So we're probably going to, we're probably going to see disease again. I don't know exactly where we're going to end up. If you look last year, if you could look back last year, again, I took a look at this last night too, is that we had the spike around October. We really had a significant amount of cases, but then it really fell in February. Is that the way it's going to look or not? Again, this disease, it has a mind of its own. It really does. And so the best thing to do is we need to take our precautions, get vaccinated, wear our masks when we can, and make sure that we're doing those things to keep ourselves healthy. Sorry, a little long-winded, but I think those were really good questions. Thank you.
Okay, Dan with 106.1, go ahead with your question.
Who? Dan? Dan, we can't hear you. You are off mute though. Hey, Dan, if you want to type it in the chat, maybe. Shannon, do we want to go to somebody else while Dan's trying to reconnect?
Sure. I don't think at this point we have anyone else who is in need of a question answered.
All right. I don't know what happened with Dan.
Technical difficulties.
Just maybe wait for Dan to have maybe type in the chat or not. It's interesting. Been almost 2 years, like I've said a couple of times, since we started this long process of COVID, and I know every community is fatigued, and everybody is fatigued. But we still have some work ahead of us to do to try to knock this thing down, so that again we can get even more of a normal life. And so it does start with each one of us and our individual responsibilities. Again, if you're concerned about getting vaccinated and you got questions, please contact your doctor, talk to them. Really increase your knowledge about the vaccine and, if it's right for you or not. That is one of the best things we can do right now to keep us out of the hospitals, to, again, try to knock down the next variant possibly, and to keep ourselves healthy. And again, it is about the community as well too. And each vaccine does help the community. So as we're looking about getting vaccinated concerns, please get good information, good knowledge from those individuals who know the best. And again, that is probably your medical doctor. All right.
Eric, we have a question. We have a question from Tom at the Blade asking about hospitalization numbers broken out by vaccinated and non-vaccinated individuals.
Yeah, Tom, I don't have anything current. Let me see if I can get that for you and get back to you. I know we've been keeping track of vaccinated individuals and positive cases, unvaccinated as well. So I think our last count for all those that we've had vaccinated, we've had about 1,000 individuals who've had, symptoms, who've gotten sick but have tested positive for vaccinations, or excuse me, have had vaccinations but tested positive for COVID. Let me find out about the hospitalizations for you and see if I can't get back to you. Oh, and one of the symptoms most often associated with COVID, Tom, it's always hard talking about the symptoms because everybody's a little bit different. We know that those symptoms of a loss of taste and smell are indicative of COVID, but then we have a lot of those that overlap other diseases. So, unless you have that loss of taste and smell, it's hard to say, well, is it flu? Is it cold? Again, we got tests out there now for both flu and COVID, so we can differentiate there. Please remember, I think the most important symptoms to be concerned with is that inability to breathe, that shortness of breath. Whenever you have that, you need to really think about seeking medical attention and making sure that that is not an issue, whether it's COVID or another major medical condition. So that shortness of breath is definitely a concern. That onset too. I've heard, let's look at flu. Flu kind of hits you real quick like a Mack truck, where I've heard that COVID kind of gets there, you're getting sick and then you get sick. So that could differentiate too. The unfortunate thing is, we heard about diarrhea, and, that is can be associated with a number of different diseases, including COVID. So again, it's difficult. And again, I urge everybody, look on CDC website, and they have some checklists too, that if you're really concerned, you can say, well, is it hay fever? Is it cold? Is it flu? Is it COVID? That might help too. All right. I see no other questions. Again, happy Thanksgiving, everybody. Please stay safe. Again, media, thank you for all you do. We could have not done as good of a job we could about informing this community without you. So I give thanks for you guys and what you do, and you're a big part of our response. So thank you. Happy Thanksgiving, everybody.